In the last lecture we talked about why we might synchronize estrus, some of the advantages and disadvantages of synchronizing estrus. In this part of the lecture we want to talk about what are the characteristics of an ideal estrus synchronization treatment and what are some of the requirements for synchronizing estrus. If we're going to apply treatments and they're going to be effective at synchronizing estrus, what do those treatments need to do? So that's the focus of what we're going to do in this session. If we had an ideal synchronization treatment, what would it do? And most protocols can't do all these things. But if we had an ideal program, this is what it might look like. It would produce a high response rate when initiated at any stage of the estrus cycle, and also in animals that are not undergoing estrus cycles. So it doesn't matter if the cow's cycling or not. If I apply this treatment, she'll ovulate and get pregnant. That'd be great. It doesn't always happen though. It should produce a precise synchrony in the time of estrus and ovulation. That is, I'd like all those animals to come in heat within 24 hours or less if possible. I should be able to inseminate those cows at a fixed time. That is, I'll treat them with a drug or a bunch of drugs at certain days, and then I'm going to come in at 12 o'clock on whatever day and go ahead and inseminate them, and they'll all get pregnant. That's ideally what I'd like to do. So I don't even have to detect heat. I just go in, inseminate, and that's called fixed time insemination. And there are protocols that are used for fixed time insemination. The fertility should be normal, so we don't want to do these programs and result in fertility that's less than normal. And once they've had the treatment and been inseminated, if they don't get pregnant, they should come back in heat again 2 to 3 weeks or 3 weeks later, and that fertility should be normal at the subsequent estrus. We'd like them to be as cheap as possible as well, and simple to implement, and not produce unacceptable tissue or milk residues. There are some protocols that we can't use because, for example, the European Union won't accept milk from dairy cows that have been treated with estrogen. So we can no longer use estradiol benzoate or estrogens to synchronize estrus in dairy cows. In Northern Australia, where animal handling is often difficult and stressful, treatment regimes need to be of minimum duration and require as few manipulations as possible. So it's no point saying, well, look, we can get really good fertility if you use this protocol, but I'm going to have to treat your cows 25 times. They're going to have to come in and out of the yards 25 times. Well, it's clearly not going to be practical, is it? So we like to minimize the number of interventions that we do for practical reasons. One thing that often happens in Northern Australia, if you've got a large number of cattle, then you need a fair bit of feed close to the yards, because in between treatments those cows need to be fed. So if you don't have enough grass around the yards, then the cattle are going to have to be sent quite a distance from the farm, and so it's going to be quite costly to bring them back and forth into the yards to get them treated. So it's just a few things to bear in mind. So this is all the ideal things that we would like, and you just need to bear that in mind a little bit when you're trying to understand these protocols and what farmers want and need. Okay, let's talk a little bit about what are the requirements for synchronizing estrus. Again, this gets back to if I'm going to apply a protocol, what would I like that protocol to do, or what does it need to do if I'm going to get good synchrony and good fertility? The first point is I need to synchronize a decline in plasma concentrations of progesterone, or if I'm treating with an exogenous progesterone or progestogen, then I need to decrease those concentrations synchronously. This mimics a situation when an animal goes from diestrus into proestrus and estrus. You get a decline in progesterone. So if I'm going to synchronize estrus, if I'm going to get all those cows to come into estrus at the same time, then progesterone needs to come down at the end of treatment in all of those cows at the same time. The other requirement, and not all protocols can do this, but this is what we want to happen as well. The other requirement that we require is we want to synchronize follicular development. That is, if we synchronize a decline in progesterone, but the follicles in different cows are maturing at different rates or at different times, then their pattern of onset of estrus will be different. So we want to ensure that follicles are at a similar stage of development are present at the end of the synchronization treatment, so that cows will develop follicles that start to produce estrogen and ovulate at the same time. So we need to synchronize follicular development. We also need to ensure that the follicles which ovulate have normal fertility. Now, there are some treatments that can affect the viability of the follicle, what we call aged follicles, or if follicles are too young when we try to ovulate them, that can affect fertility. So we need to ensure that those follicles have normal fertility. And we also need to ensure that concentrations of progesterone following the synchronized estrus, that is, following artificial insemination, that you'll get a rise in progesterone following ovulation, and that rise in progesterone will be normal. It's no point if they ovulate and the concentrations of progesterone are far below what they would normally be, because then the pregnancy will probably fail. So these are some of the general requirements that we want from any synchronization protocol. Okay, this is just to illustrate the same points graphically. So we want all the cows to be undergoing this type of situation together at the same time. That is, progesterone will decline, follicles will be growing in a similar pattern at the similar stage of maturity in all the cows at the same time. Once progesterone comes down, estrogen rises in a similar pattern in all the cows, and then that induces an LH surge at about the same time. Following ovulation, we want progesterone to rise, and we want cows to have a normal diestrous pattern of progesterone secretion following ovulation, and hopefully get pregnant. If they don't get pregnant, we want them to come back in heat about 3 weeks later. This oocyte that ovulates also needs to be of optimum fertility. So there's some of the requirements for an ideal estrus synchronization treatment in cattle. So here we'll just summarize this again. What do we need to achieve a precise pattern of onset of estrus and ovulation and achieve normal fertility? We want to synchronize ovarian follicular development, ensure that the emergence and rate of growth of follicles, estrus and ovulation occur at the same time in all cows, so that this follicle pattern is emerging at a similar time in all cows at the same time. We want to synchronize a decline in circulating concentrations of progesterone, that is, induce the follicular phase of the cycle in all cows at the same time. So again, we want concentrations of progesterone to decline in all cows at the same time. So if we're treating with progesterone, we want to somehow stop treating them with progesterone at this time. We want to synchronize a preovulatory LH surge and an ovulatory stimulus at the same time. So once progesterone comes down, we've got a nicely matured follicle. We want to induce that follicle to ovulate. This can occur spontaneously, either through production of estradiol, which is this red line by the follicle, which will then induce an LH surge, or we can inject drugs to induce an LH surge at the same time. We want to ensure that the follicle that ovulates is at an optimum stage of maturity. That is, if ovulation is induced and follicles are too immature at the time, they may not ovulate, or they may ovulate and produce a small corpus luteum which secretes less progesterone. So what I'm talking about here is if this follicle is too small, say if it's at this stage, at this point, and we're trying to force ovulate it, it may not ovulate because it's too small, it's too immature, or it may ovulate and produce not enough progesterone. So instead of being a cycle like this, progesterone might be lower, much lower than normal, and fertility will decrease. If follicles, on the other hand, are too old, that is, at the time when we cause a reduction in concentrations of progesterone, then those cows will come in heat, but fertility will be less than normal because the follicle, the oocyte in the follicle, will be too old. This is a situation where if we treat with progesterone here for too long, then this follicle will keep getting bigger and bigger, or it may get bigger and bigger, and then if we cause a decline in progesterone out here, then the follicle is a little bit too old, and the viability of the oocyte will be less, and that can cause a reduction in fertility. And then finally we want the corpus luteum following ovulation to secrete an adequate concentration of progesterone. So following ovulation we want an adequate concentration of progesterone being produced. So this is the ideal of what we need with any oestrous synchronization treatment. So I may just stop there for a while and allow you to perhaps revise this a little and consider again what those principles are, and we'll go on to explain them more with the next session.